Hi there, this is Edge-Hughes. I'm one of the therapists here at the Canine Fitness Centre, and I want to create this video to show you some of the things that you can be doing at home with your dog who's just had surgery. So this is Macy, and Macy had her surgery 3 days ago. So she's had a cruciate surgery, a TPLO, and so this really is what you're going to expect to see. Is there will be some swelling. She kind of has some fat ankles right now, and thickened swelling in all around, actually all sort of her knee and below. Not too much coming up from there. And if we look at the other side, she's got a lot of bruising. So that's to be expected, and that's all right, but it certainly is something that we want to target. So one of the things then that you can be doing is even just some nice stroking for trying to move the fluid. Now where you want to aim the fluid is to the back of the knee and into the groin. So you want to aim for lymph nodes where the body can best take that fluid and dissipate it. So if you take everything from down at the foot and up the leg, okay, the calf area, and take it to the back of the knee. Okay, you can even swoop, go to the back of the knee, and take the under surface and come around to the back of the knee. So if you start a few strokes moving that way, and then move upwards and kind of come up and towards the inner thigh and into the groin. Good. So you're just thinking about moving fluid and trying to bring it up, okay? So then high nose up, so then it can go basically tracking through the lymph node, through the lymph system, into the blood, and then excreted. So this should always be comfortable for your animal. You don't want it to be uncomfortable. She doesn't have any gel or cream or oil or baby oil on her, and she should be fine with that. You certainly don't need to put anything on, and you may want to be cautioned about putting something on because it may encourage the animal to lick, and we don't necessarily want them licking. Okay, and as well, this is just going to help because the dogs are going to be itchy after they've been shaved through there. So the massage is going to be part one of what you can be doing at home. Okay, part two, I would say, is joint compressions. In fact, it doesn't matter what joint has had surgery. If you think about, take the joint, put one hand at the joint you're affecting and one hand the joint below, and in this case I'm just going to do a tiny little compression. So you really can't see too much. I'm kind of being a little bit, moving a little bit in excess just so that you can see what's going on, but just tiny little compressions. And you can do it in a couple of different ranges, so a little bit in extension, a little bit into flexion, and through there, and all you're doing is just kind of tapping the joint surfaces together, and that's going to help the cartilage within the joint. Cartilage gets its nutrition by bathing all of its surfaces in synovial fluid, so that will help with joint nutrition at the stifle, but it also seems to be very good for helping to dissipate swelling, and it's something very simple. You can do teeny tiny little ones. You can actually be a little bit more aggressive too. You're not going to do any damage. You can't take a run at it from across the room, but that's the only caveat. Just nice little compressions like that, okay? And even you can sit there and do it through whatever, every commercial break. If you're watching TV together, commercial break is 2 minutes, you can do that for a couple minutes then. And there's no rule, you can do that as many times during the day as well. In fact, the more the better. It's going to help it dissipate faster. Good. Now, your range of motion that you can be doing, okay, lots of times people are told to bicycle the leg. However, dogs don't ride bicycles. So what might be a little bit better is to do just, first off, just a total, yeah, you're good, flexion. Actually, even just start with flexion of the knee. It's okay to go to a point where the dog acknowledges, but it should, like that, good job, but it should always be pain-free. So we don't want her to be in any great discomfort. And the same for the extension. Sometimes the end range of extension is uncomfortable. So just back and forth. And even if you're worried and you're just kind of sticking with the mid-range, that's okay. Because at this point in time, the reason you're doing it is for dissipation of swelling. Yeah, we were going further before. You're okay. Yeah. Alrighty. Alrighty. Okay. So, flexion extension of the stifle is going to be very important. And you might want to even look at doing a little bit in the hip. Oh, yeah. Now, going into hip extension is going to stretch some of the muscles of the thigh as well as in the hip. So even if we're just doing this, oh yeah. Yes, we got lots to say. So even just going, and it really all you're trying to do is do some of the motion. You don't have to be getting to the end range. We're not trying to get to end range of motion. We're just trying to get some movement in there, again, mostly to dissipate the swelling. Now, to go down to the tarsus, so ankle if she was a person, go down to this joint. The ankle in a dog does not bend unless the knee also bends. Okay, so they kind of go together. So you're going to go to about there, and this one, I really pay attention to what she likes and doesn't like, because that one, it stretches, it kind of causes a bit of a motion at the knee when you stretch the Achilles tendon. So I just go with totally within her comfort there. Good girl. Yeah, you're very good girl. Good. Okay. So your first little while, you don't really need to be pushing very hard to get your, oh, so nice for camera. Okay, you don't need to be pushing very hard to get full motion in that knee. You're really just trying to get any kind of motion. If you want, what's better than bicycling is to go through a walk-run pattern. So if we pretend she's out running in the field and she brings her foot forward, and then she would, are you going to play with me? You going to do it? Touch the ground, go back, and then come up. Oh, yes. Yeah. So we mimic a walk-run pattern, which is, I know, no girly parts. Okay, which is far more functional than bicycling. So if you do want to, you can do individual joint range of motion, but you can also do that walk-run pattern for the range of motion. Good. Lastly is going to be your icing, and you can ice anywhere in the stifle, okay, so the knee or below the knee to try and get rid of the swelling, and it's also very nice for pain relief. What can work well is you can use frozen vegetables. Peas or corn works nice because they are moldable, but label them so you don't eat them afterwards, because the thawing and refreezing denatures it. So don't eat them again. Label them dog peas. The alternate would be to use, you can create your own gel pack with equal parts of water and alcohol. So rubbing alcohol would work, or gin, but then you might be tempted to help yourself to that bag afterwards. Anyways, whatever other alcohol you have in the house, equal parts, stick it in the freezer, and it will not fully freeze, it'll become a gel, and then you can just, in your Ziploc bag, leave it in the Ziploc bag, and you can mold that around the dog's leg. If it is freshly shaven and it feels like a baby's bottom there, you may want to put down a wet face cloth over top, just so that the plastic doesn't stick to the dog's skin, and then you have to take it off, and it kind of tears a little bit. So you may want to look at using a face cloth when they don't have even this little baby fuzz, this little fuzzy bit grown back. The alternate for just icing would be to alternate hot and cold. When the rule of thumb is you start with cold, end with cold. Okay, and then you just would go maybe 30 seconds to a minute, but 30 seconds of the cold, switch out to your hot pack or hot water bottle, 30 seconds of the hot water bottle, you're good. I know, she's itchy. Let me scratch you. There. So, 30 seconds 30 seconds of each, and basically what you're doing then is getting the blood vessels to constrict and dilate, so you get a bit of a pumping mechanism to try and get rid of the swelling. So that would be excellent as well. So, and beyond that, really you're just taking your dog out to do it's pottying in the backyard. Make sure that your dog is on a leash so it doesn't get excited if it sees a squirrel or anything like that, and you'll carry on from there. So hopefully this helps you, that if your dog is having a joint surgery or any kind of a surgery, you will have some ideas of what to expect, and certainly we are always here to help you. If you want to give us a call, we can help you through that process. Thanks.